Human Immunodeficiency Virus. Nurse 444 Community Health Nursing Course. This is a clinical presentation for the Health Education Program by Katie Grogan, Indiana State University, LPN to BSN student. The learning objectives are as follows. Define HIV, identify the population at risk, list the signs and symptoms of HIV, understand the transmission of HIV, identify the HIV stigma, know resources available, and successfully take the pre- and post-exam. Pretest. Question 1. How many individuals are affected by HIV and are not aware? Question 2. Which of the following are ways that can HIV be transmitted? Question 3. Which of the following is not a stage of HIV? Question 4. Which of the following is another name for the chronic HIV stage? Question 5. What does the virus do? Question 6. Which population accounts for the largest number of HIV infections? Question 7. How long can someone be in the clinical latency stage of HIV? Question 8. How many people in the U.S. have HIV? Question 9. Approximately how many people are unaware of their status? Question 10. There is no blank for HIV, but it can be blank. HIV defined. A virus that attacks cells that help the body fight infection. The population at risk. According to the CDC, while all Americans are affected by the HIV epidemic, some populations bear an especially heavy burden and account for the largest number of HIV infections. Gay and bisexual men of all races and ethnicities, most severely and disproportionately are affected, followed by African Americans, Latinos, injected drug users, and transgender individuals. No effective cure exists for HIV, but with proper medical care, HIV can be controlled. The symptoms in stages. The acute HIV infection presents with fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. This continues into the clinical latency, the chronic HIV infection. This is the second stage where the virus is still multiplying, however, the levels are very low, but still detectable. The person may not feel sick and be asymptomatic, and without treatment, they can be in this stage for 10 to 15 years. Late-stage HIV is known as AIDS, acquired immunodeficiency syndrome. Eventually, when the virus weakens the immune system, HIV progresses to AIDS. Signs and symptoms of AIDS: weight loss, reoccurring fever or profuse night sweats, extreme fatigue, prolonged swelling of the lymph nodes, diarrhea, sores of the mouth, anus, and genital, pneumonia, red, brown, pink, or purplish blotches on or under the skin, memory loss, and depression. How is HIV transmitted? Through sexual behaviors, breast milk, and needle and syringe use. Also through bodily fluids, which can be vaginal, rectal, blood, or semen. Here's a diagram of the HIV diagnosis dependent on area based on age. So as you can see, the highest number of individuals affected is in the 25 to 34 year age range. There is an estimated 1.2 million people in the United States that have HIV. 161,800 are unaware of their status. That equals 1 in 7 individuals are living with HIV and are unaware that they are infected with the infection. Part of it is because of HIV stigma. It affects the person emotionally, their well-being, and their mental health. They often internalize the stigma and have a negative self-image. These are reasons that they are reluctant to seek out getting care. There's fear of discrimination and being judged. So as public health nurses, and community nurses, we must promote education, encourage individuals to seek treatment, and help them to understand that nurses don't see the stigma. We see the individual for who they are and their need for health and well-being. Post-test questions. Number 1, how many individuals are affected by HIV and are not aware? 1 in 7. Question 2, which of the following are ways can HIV be transmitted? All of the above. Which of the following is not a stage of HIV? The intermediate stage. The acute, chronic, and late stages are all stages of the HIV infection and how it progresses through. Which of the following is another name for the chronic HIV stage? C, clinical latency. Again, someone can stay in this stage for a very long period of time. Question 5. What does the virus do? It attacks the cells that helps the body fight infection, and that is the true definition of what HIV is. So the virus is attacking the cells that the body needs to fight off infections. What population accounts for the largest number of HIV infections? Gay and bisexual men. How long can someone be in the clinical latency stage of HIV? 10 to 15 years. Question 8. How many people in the U.S. have HIV? Over 1 million. Question 9. Approximately how many people are unaware of their status? 160,000. Question 10. There is no cure for HIV, but it can be controlled. Here are 2 very valuable resources that provide a plethora of information and should, as community health nurses, these are 2 government official sites that we can encourage members to seek out guidance, look for resources, know that they're not alone in this, help break the stigma associated with HIV. All of the information found within these slides is through the CDC, the Centers for Disease Control and Prevention, and HIV.gov.